Hi guys. So some of us are having trouble in which the tad heads are not getting locked in, or the tad heads are just spinning in there. We think that the driver heads are spinning. It's not locking in. So we're going to learn how to do all this. The number one thing, you want to inspect your tad head under the loops to make sure all the edges are nice and intact. The edges haven't been rounded. All right. So if that's the situation, obviously the driver head is going to spin. But that usually happens after you insert it. So why does your tad head keep spinning in the driver and not going in is what we're going to learn today. So if you have an MSC or any kind of skeletal expander, the one with the four screws is what we're going to talk about. In an ideal world, you want all these four screws to be sitting parallel, right? Because we know then the force is transmitted very well like that. In the real world, what happens is that sometimes the screws tend to grow crooked. And what does it cause is a lot of binding between the expander and the screw that's going in. We'll learn a little bit more. Okay, so when you start driving your MSC into the palatal tissue, um, what happens is the MSC is far away from the palatal tissue. There's this mushy, squishy tissue in between. And even if it is not far away, there's still some amount of squishiness does the palatal tissue have. So I'm going to do it the other way around now. What happens is that as you're trying to drive these TADs into the MSC, you want to be very careful. Pay attention to how your MSC box is tipping. If it starts, say you inserted this TAD fully and the rest of them have not been inserted yet all the way, what's going to happen is if this is inserted fully, your MSC is going to start tipping in and your screws are going to get locked in. Right in here, there's where your binding is happening. And if your screw is binding in, when you turn the screw, you hear that squeaky noise, stop, pull back, because a little squeak in the beginning is going to turn into a big squeak later. And then obviously your driver head is not going to be able to spin the screw any further. It's going to bind right here in this metallic box of MSC. Okay, so when you're screwing in these MSC TADs, if you have all four of them, you want to make sure you tighten this a little bit, come crisscross, tighten the other one a little bit, come back again, tighten this one a little bit, a little bit. Anytime you feel resistance in one of them, inspect the direction in which your TAD is going. At times, the hand drivers help out a little better. But then what happens is you're looking at this upside down into the patient's palate, you're getting disoriented, and the direction sometimes doesn't stay consistent. At times, the box of the MSC starts dipping into the palate area. So if the box of the MSC in itself is tipping in as you put in your first screw, you got to be very careful. Because guess what's going to happen to the next of the screws? As you're trying to put them vertically in, they're going to get binding into this eyelet where the screws go in it. So be very careful. Take your time. Don't rush your deliveries. Understand how your expander box is fitting in, and then insert the screws at an angle. Because usually it's the binding in the eyelet of the MSC and the TAD that is going to offer a lot of resistance for you to take out or drive the head in. Hope this helps. We call this the Moody video.